allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. No public comments. We'll move on to 4, approval of the April 2nd, 2025 Health and Human Services Committee meeting minutes. Motion on table, second. All in favor? Aye. Any opposed? Motion carried. Thank you. Operational functions required by statute, ordinance, resolution, or policy. Discussion of possible action by Health and Human Services. Nothing. Discussion of possible action by Health and Human Services to Fort County Board for consideration. Nothing. 6, educational presentations and committee discussion. A, Social Service Department Family Keys Pilot Program, update and outcome review. I believe she is not going to be here, correct?
Yes, Mr. Chair, I can tee that up, but the idea was to have, I apologize. My voice is failing me today, but Krista Jensen from Social Services had intended on being able to attend to give you an overview of the outcomes to this point relative to the Family Keys program. So again, just grounding everyone, this is a pilot program that Marathon County, along with La Crosse County and Wood County, were selected by the Wisconsin Department of Health Services to participate in Family Keys across those 3 counties. The idea being to address housing instability as a means of increasing family stability by preventing or mitigating the length of removal of children from the home of their parents when the primary motivation for doing that was unsafe or unstable housing. So again, as a background, we've been participating in that for the last about 2 years. Krista's not here to walk you through this. She can certainly do that at your future meeting. We had kept your agenda intentionally short, and it's getting shorter, to allow for the committee to attend and participate in a tour that Aaron has put together of the community-based outpatient clinic, the Veterans Community based outpatient clinic after today's meeting, beginning at 4 o'clock. But the idea, again, teeing this up as we move into budget discussions, because again, one of the areas that the county board certainly focuses on is what programs or services do we deliver? That's that first policy question, at what level, and then lastly, at what cost. So this was a pilot program. Again, the hope of the Department of Health Services was to demonstrate through these pilots that the funding is sustainable and that it would reduce the necessary county allocation for out-of-home placement dollars. So Krista put together a number of slides that, again, you can review before Krista comes back for your next meeting to have questions. But we've had a fair number of families participate in that 2-year program. So you'll see on page 4 of your packet, we've had, since the program started, 21 families and 53 accompanying children that have gone through this program. So a fair number of families participating. A key component of the program is really accountability, that it's not simply providing that stable housing, but it's providing the housing on the condition that families that are participating are doing things that will make their own housing sustainable long-term. So one good example is that they participate in any programming that their housing coordinator would deem appropriate, including setting aside dollars so that they can essentially long-term take over the leases that the county and the housing coordinator work to put in place. Again, based on the guidance that the county board put together, this program really was the product of what I'll say is a collaborative effort back and forth. The county staff hearing some concerns that county board members had back in 2023 about how to set up the program, moving it away from a congregate living approach to one where truly individual families were paired with landlords, and the idea, again, long-term being that at the end of the program, these families were able to transition into successful leases with those landlords. And I think our outcomes, as when I look at them, and Krista's slides here kind of summarize it, overall, we've seen a fair amount of success. Not 100% for sure, but Krista can talk you through what those will equate to in terms of the work we do. But the big question that will be confronting the county board moving forward is how do we make sure if there is a desire to continue this program, because I think it has demonstrated a more meaningful, successful approach than simply providing housing, which is, again, a component of our work we have to do. We have to ensure that those children that we're working with are in a safe and stable placement. This is essentially an alternative to foster care placement. The good thing about this alternative is it's substantially cheaper. And I think as at least the data that Krista has presented to me in the past has shown, it is more sustainable from a long-term perspective. But just to let you know what else is in the outcome measures and the information, I think it would be helpful if on your own time before your next meeting, again, to generate some questions you might have. But there are a series of videos that are hyperlinked within the presentation slides that Krista put together. Again, we're one of 3 counties across the state that were selected. There's a series of those videos that do incorporate kind of the lived experience of the participants. So you'll hear a number of testimonials. There's a slide here that has some of the quotations from the participants, but you can see testimonials from not only the participants, but also from local partners, including law enforcement. At the end of the day, if we compare this approach to kind of what had been our historical approach of really being on the front end of simply providing the fiscal resources for those individuals to stay in housing, based on Krista's initial comparison, you do see a net savings. Of course, that's a net, right? There's still an allocation of funding, and to make this sustainable in partnership with the community, which we continue to look at how do we make sure that it's sustainable, searching out those opportunities for those community partnership opportunities, I should say, to offset program costs is a goal that Krista's set for her department. But at the end of the day, this is not a key area where the county is mandated to provide the service specifically in this way. So I know that's less than what you were looking for in terms of a presentation, because Krista had something come up that required her presence and she couldn't be here today. But this was not agendized for action today, and it wouldn't be agendized for action at your future meeting. But I do think it very nicely tees up a conversation that you will have to have during budget development. So I apologize, Mr. Chair, I can't give you a much more detail than that, but I would encourage everyone. I took the opportunity to click on those hyperlinks and watch those videos previously. I think they do speak to some of not only the fiscal benefits, which are more clearly laid out in the slides, but also the kind of the experience of the participants, particularly in our model, which of the 3 counties, I know I'm probably not the most impartial reviewer, but I think our model has demonstrated that it can be successful, and I know DHS has a desire to really make more widely known our experience and have other counties evaluate adopting a similar program. But at a future meeting, you'll certainly have the opportunity to ask more questions of Krista.
Questions for Administrator Leonard? If not, like you said, Christie, you can come in next time and we'll talk it through again. All right. With that, we'll move on to 6B, update from Homelessness Task Force. And I see that Ron showed up, so we have both guys that are on the task force. So whoever wants to tee it up, go ahead.
Sure, I can start. So on May 19th, we had our presentation to the full board and the city council. It went well. I think the outcome was well received by both the county and the city. The outcome was for Administrator Leonard and the city to work together on developing a plan in the next 12 months to have that plan ready to present to both the city council and the county board. A lot of data was presented. If you haven't watched the meeting yet, I would suggest watching it because there's a lot to it. And I think that everybody that was at the meeting had some really great comments about the presentation and how the task force presented it. So, thank you.
Supervisor Conway, do you want to add anything?
Well, that's probably the highlights. The one thing, actually, I do remember we kind of left out, when we looked at the data for the demographics for people that use the shelter, the emergency shelter, 3/4 of them had issues like we discussed, chronic health issues, mental health, AODA concerns, disabilities, things like that. But 25% didn't. So there's 1/4 of the folks that are homeless and unhoused that aren't having to be impacted by things like that. And there's justice impactment, but there's other things in life that can turn that into a situation for someone. So it's kind of an alarm that it can happen to anyone. And there's a lot of folks, if you look at the Alice report, 1/3 of the county is at that level where just one big medical bill will be detrimental. So that's just something to keep in mind as well. Otherwise, yeah, no, everyone thought it was good.
All right, I'll open it up to the board. Anyone else that want to discuss or questions, comments?
Thank you, Mr. Chair. Aaron Galindo with the Veteran Service Office. I don't have anything agendized for this, but I just got a notification yesterday. So the VA homelessness program is going to be hosting a surge event for Marathon County, Portage County, and Wood County. They're looking to get in contact with homeless resources in the area. I have a point of contact for that, and I can get that sent out. Her name is Danielle. The intent of the surge event is to develop a team to go out into the communities or areas where those who are homeless may be, identify and engage with them. Any veterans, this is specific to veterans, obviously, and connect them to resources and rapidly rehousing them. Those resources would be things like the HUD-VASH program, CVI, the Center for Veterans Issues, and VORP, Veteran Recovery and Housing Program. Currently, HUD-VASH is out of vouchers for our area. There's over 50 veterans in the area utilizing the voucher program, which pays for a portion, I think it's up to 80% of their rent, to keep them from becoming unhoused. So I know when I talked with some of the homeless task force or people who are involved with that, during the point in time counts, there really have not been any veterans picked out or have self-identified during that, which is awesome. But this is just another thing that the VA is doing, and I just got notified of it 6/3, so yesterday. They're trying to host a meeting tomorrow, so I'm going to sit in on that and see what they have to say, but I just wanted to give you guys a heads up that that's something else that is going on and available. And if I get any valuable information, I'll send it forward, or we can plan ahead, or if I can get contact information, I can maybe refer them to you guys, so that way they can reach out as well and be an additional benefit or resource to go through. So that's all I have, Mr. Chair.
Thank you. Anything else? All right, we will move on to 7. Next meeting date and time, announcements, future agenda items. Committee members are always asked to bring future discussions to the chair or administration. Next meeting is actually going to be Wednesday, July 9th, if that works for everyone, because I think most people on the 2nd are not going to want to come to a meeting. That work for everyone? Anything else going on that day? And then,
Resource at 3
what time?
3 o'clock on the 9th, human resource.
So there's another meeting. Do we want to do before or after? Health and, what'd you say it was?
3 o'clock is health and human resource.
Health, HR finance. HR finance is at 3. Do we want to do like a 4:30 or a 1:30?
Yeah, 4:30 works for me. I can't do 1:30, but 4:30 will work better.
Don't they be done by then? He doesn't think they'll be done by 4:30. Okay.
I have another board meeting starting at 4 that day.
I think that 1:30 is public safety.
What about 3? What about Tuesday, the 8th? At 3 o'clock, same time, just a different day. Plan on that? Let's do that. July 8th. Probably forgetting something because I haven't looked at my book yet, but otherwise I can do it remotely. All right, with that, I will take 8. Remember, there's a, if anyone was interested, we're going to do the VA at 4 o'clock. I will not be able to make it, unfortunately, but go ahead, Ron.
That's the old Shopko Plaza?
Yes.
Okay.
Somebody want to adjourn, or are we not going to adjourn today? All right, motion made. Do I have a second? Motion 1 second. All in favor? Aye. Thank you.